Okay, we'll go ahead and get started. So my name is Renee. I'm a housing support specialist here. I'm also finishing up my master's of social work. So this is part of what kind of like rounding out my education, and I wanted to share what I've been learning in my internship. Because some of it definitely applies to what we do here at UMOM, and especially in the rapid rehousing. So today I wanted to talk about kind of the intersection between mental health and prison. We have a lot of clients who have felonies on their records, and we also have a lot of clients who deal with mental health issues, and a lot of those issues overlap. So we might have clients who have felony records and also have mental health issues. And a lot of times being in prison, if you have a felony on your record and you went to prison for that, can lead to developing mental health issues. Um, so what I'm going to go over is going to be a general overview, and it's going to mostly relate to the Arizona Department of Corrections. So that's going to change depending on what state you're in. It's going to change from jail versus prison, and it'll also even change between like state prison versus a private prison. Um, but a lot of what I'll talk about as far as implications for us as case managers or housing support specialists is kind of a blanket thing. Um, well, let's see. I do have a quick poll that I want to do. It's going to be anonymous, so please be as honest as possible. But it's going to pop up, and it's going to be like 6 questions it's going to ask you about. So I'll give us a few minutes to do that. And let me know if you don't see that pop up. Christopher asked how I like my coffee. I'm actually drinking tea because I don't talk a lot very often. So doing this training is a lot of talking for me. So I have to like keep the keep the throat feeling good. Awesome. Thank you, Yuri. Well, looks like most of us are done. We'll just wait a few more seconds. If anyone's just joining or just came on in the last few minutes, we're just doing a quick little poll about what we already know. This way I'm not going like too into detail about stuff that we already know. All right, we're gonna go ahead and move on. Thank you for doing that. Definitely appreciate it. It helps me a lot with being able to do this training. So before we get started, does anyone have any questions about this topic? Things that they really would like to know, anything like that? Right, just go ahead and get going. So the things I'm going to be covering during this training is how prevalent is mental health concerns in Arizona prisons? How are they handled? How are mental health concerns managed in the Arizona Department of Corrections? What are some direct experiences that people have had in the prison system as in regards to mental health? And what is re-entry like? Just a second. What is the reentry process like, and what are some resources that are out there? And what are the implications for case managers? What can we do on our end? How can we approach these experiences that our clients have? And then last will be additional resources and also some like books and movies that you can watch if you want to learn more about this. So for a small history lesson, in the early 1900s, early 20th century, we had what's called mental health institutions. So that's where people who had severe mental illness would go for long-term care. They would live in the institutions, they would be treated there, and that's kind of how we managed severe mental illness back then. The problem was that there was a lot of abuse and mistreatment. There wasn't a lot of evidence-based care, and people weren't as well trained as they are now to manage and treat these illnesses. So there was a lot of abuse and a lot of mistreatment. So in the 1950s, they started what's called deinstitutionalization, and that's where they take everyone who's living in these institutions and they transfer them out into the community. So they're either living with their family or living independently, and they're getting their mental health care at mental health clinics, community clinics. And this was the intent. And the intent was really good because we wanted to make sure that these people had the ability to get treatment, but also be in a living environment that is conducive to good mental health and safe. The problem was that the transition didn't go very well. So all of the funding that was in the institutions, because the institutions are going away, that funding went away, and it didn't get funneled into the mental health community. So those mental health clinics either didn't get built, or they were severely understaffed, definitely underfunded. So there were not enough mental health clinics to accommodate the amount of people that are coming out of those institutions. And this, of course, led to increased mental health issues. So those people coming out of the institutions, if they don't have family or other supports, they're going out on the street. They don't have anywhere to go. There's no mental health clinics, or there's very few, especially if you're in a rural area. So they become homeless. It's hard for them to obtain and maintain employment. So getting out of that homeless situation is very difficult. And all of these things lead to the person's mental health and life circumstances degrading to a point where maybe they have to commit a crime to get food, or they are becoming a danger to themselves or others because their mental health symptoms are getting worse without treatment. And this became a cycle, and it's still a cycle that we see today, where people have severe mental illness, no access to resources, no supports, and they have more interactions with police, which then lands them in jail for maybe a night, or, depending on the severity of the crime, they can be in jail or end up being in prison for several years. But then they come out and they re-enter the community, but there's still that lack of resources. So that cycle just continues. So now prisons have become the primary institution for mental health care. That's where most people get their mental health treatment. So I want to go back to that poll that we did earlier, and I think, let me see. I think most everyone said that 57.9% of inmates in Arizona Department of Corrections were in need of mental health treatment, and that's true. That's a high number. So almost 60% of inmates are in need of some kind of mental health care in prison. So if we compare this to the overall population, in any given year, about 5% of the overall population is going to need some level of mental health care. So 5% of the overall population versus 57.9%. And this was just in 1 year, in 2019. This also doesn't account for substance abuse issues, which is, I think, we consider mental health issue now. It's part of the DSM, and we consider that behavioral mental health, but they don't consider that in the reports, the Arizona Department of Corrections reports. They separate that. And 78.4% of inmates were in need of moderate to intense treatment. That's not including everyone who needed some kind of substance abuse treatment. That was just moderate to intense treatment. So you see that they have a high population of inmates who are in need of treatment of some kind. Prisons are not equipped to provide this kind of treatment. They're not treatment centers. They're institutions that are meant for public safety. So their goal, their intent is not to treat and rehabilitate. It's to incarcerate and to protect the public health and safety. So there's a constant low staff of mental health providers. So prisons do have mental health care workers that work with the inmates, but they're constantly understaffed. There's not a lot of funding for that. There's a very high turnover rate because they don't have the resources that they need to do what they know is best practice. There's a lot of turnover. So this leads to the responsibility of mental health care falling on the prison guards, and they're not really trained in mental health. They don't know how to treat, they don't know how to care for mental health issues. So what ends up happening is they just manage these inmates. They just handle them in a way that that is safest for the prison and for the public. And that leads to segregation. So they put severely mentally ill inmates into isolation units, what's called solitary confinement. So oftentimes if somebody is on a suicide watch or they have severe psychiatric issues, they'll be segregated from the main population and be on their own in a cell for however long their symptoms are severe. And the conditions in these isolation units are not conducive to good mental health. So this exacerbates symptoms. So often they're dealing with sleep deprivation. They can't get more than 30 minutes of sleep because they're constantly being checked on. They're in complete isolation. So, I mean, there's like a steel door separating them from the guards. They don't have any interaction with the main population. And they get about 6 hours out of the cell a week. So not even an hour a day. And often this out of cell time is still in a cage that's separated from the rest of the population. So you can see that's not very good for treating mental health. It's just a way for them to manage it so that the mental health issues are not in their way from being able to do their job. I think it went too far. Okay. So in 2013, prisoners developed a lawsuit that they put towards the Arizona Department of Corrections. So the American Civil Liberties Union of Arizona and the Prison Law Office assisted in getting a settlement on behalf of 33,000 prisoners to improve the conditions of the prisons. This led to about over 100 performance measures that the Arizona Department of Corrections must comply with. And they have consistently since that time, this was in 2013 when the lawsuit was settled, since that time they have consistently not been able to meet those performance measures. In 2014, they were found to have not complied and they were given some hefty fines. Again, in 2018, 4 years later, they were still not able to comply with those performance measures and they were fined over $1 million. So you can see how important mental health care and mental health treatment is in a prison setting. It's not that important. They're willing to pay millions of dollars to not do it. So just want to give an example of some of these performance measures. They did split them up into very distinct types of measures. So things that needed improvement like medical health, mental health, dental, just overall quality, pregnancy related issues. Even in like women's prisons, they still had a lot of issues. And then they specifically wanted to address the isolation or maximum custody issues. So some of the performance measures, they're all very like common sense and things that should be done anyway. Like medical records being accurate and in chronological order, scanned or filed into the patient's chart within 2 business days. That's pretty standard for any kind of mental health care place. Another one was having a first responder trained in basic life support, responding within 3 minutes of an emergency. If you think about it, they're in a pretty small area compared to like in the community. A first responder will have to come in an ambulance to provide that basic life support. A mental health assessment of a prisoner during initial intake should be completed by mental health staff by the end of the 2nd day. This is pretty important. You want to know who this inmate is, what are their mental health issues, and what are the things that they're going to need to do on their end to make sure that everyone is safe. And then only licensed mental health staff may remove prisoners from suicide or mental health watch. This is, pretty important. So making sure that you're not taking someone off of a suicide or mental health watch if they're not ready for that. So these are just a couple of the examples. And then I wanted to talk about the very specific measure that they added for the isolation or maximum custody. So they were, they put into the performance measures that the required out of cell time should be 13 hours. That's over twice as much as they had before. And of these 13 hours, they're required to include mental health programming and psychoeducation for the client. Just like that. So before, the out of cell time was kind of unstructured. They didn't require the inmate to go to any classes or any groups. So with this performance measure, they're saying like you need to treat the inmate if they're having such severe mental health issues that they need to be separated from everyone so that they can get better and go back into general population. That lawsuit cited some very specific examples of neglect that inmates experienced. Inmates were not seen by a psychiatrist anywhere from 5 to 11 months after being placed on suicide watch. So they were in isolation units for 5 to 11 months before they were even seen by a psychiatrist. And when they're in those isolation units, the lights are never turned off. They're woken up every 10 to 30 minutes to be checked on. And they were pepper sprayed regularly to manage the psychiatric symptoms. So these are just a few quotes of people who have experienced being in prison and also having mental health issues. So this was someone who was interviewed by Human Rights Watch. I believe this was in 2007. It was an inmate in the Arizona Department of Corrections. And he's talking about being in isolation here. So he says, it is atypical by every means. I'm locked in my cell 24 hours a day, 7 days a week. I hardly ever get out of my cell. I've been put on mental health watches around 6 times, which is inside a small holding cell, stripped naked. The light is on all the time, no room to lay down for 3 solid days, no sleep, nothing. I would prefer death than to live like this. It's basically no one cares. And this inmate, Robert Towery, who was executed, I believe in 2013, he chronicled his last 35 days of life in a book, which he gave to his attorneys right before his execution, and they published it, and you can find it on Amazon. But in that chronicling, he talked about his cell neighbor a lot, who was set to be executed right before him. So this is what he said about his cellmate. I can tell you from knowing him for nearly 20 years now, this is the second time I have lived in a pod with him, that he doesn't really get it. He's guilty, no doubt, but there is no way he is culpable. What I mean is he should have been in a hospital from the very beginning. His stepmother and what she did to him broke him in a way that made him man-child. But our system is designed so that advocates speak for us, that experts come in and say things like, he's 2 points above the legal threshold for IQ, so we can execute him. And I believe in our justice system as a whole, though I've learned how broken the capital punishment part is. I think it's the best system out there, but still, men like him fall through the cracks. And I think that's another important thing to consider, that of course we need some kind of justice system, but we also want to be considering like what is the results of our justice system. Is it actually effective? So Donna Leon Ham of Middle Ground Prison Reform, I was able to interview her, and she described an experience of someone who is released from prison. So this person lived in a rural area. That's where his family lived. He wasn't able to live with his family for legal reasons, so he didn't have a lot of supports. And because he lived in a rural area, the resources were very scarce. So there was no mental health clinic that was for the community. He wasn't able to live on his own because of severe mental illness. He wasn't able to live with family. So he became chronically homeless, and he's not getting treatment where he was getting treatment in prison. As far as like medications, he was no longer getting treatment once he re-entered the community. So he often had police interactions because of this. And sadly, the most likely scenario is that he will end up in prison again because his life and his mental health would have degraded to such a point where he would probably be doing the same things that he was doing before because there's just no resources or support. So conditions within prisons and even after release, as we see, is not conducive with good mental health and reducing recidivism. So despite the lawsuit, despite the Parsons v. Ryan lawsuit, severe negligence is still experienced. So isolation units are still used to manage serious mental illness. There's even like political motivation to not treat mental health issues. So they'll provide a diagnosis of malingering, which is basically saying that someone is faking their illness for politically motivated reasons, either to help with the prosecution or because they've been hired by the state and the state doesn't want to address these issues. There's deliberately inaccurate documentation. So there's been cases of mental health care workers signing off on paperwork saying that they're a licensed psychiatrist when they're not. They don't have a license and they're not a doctor. And there's been untimely suicides due to lack of treatment. So in 2016, a medical doctor wrote a declaration, and in it stated that at least 3 inmates died by suicide within less than a year period as a direct result of the lack of adherence to those performance measures. So what about re-entering society? So once they have that experience in prison, what is it like coming back into society? And this is where we'll usually come into contact with them, and they'll come into services, maybe not right after they get out of prison, but the Arizona Department of Corrections is required to connect them with community mental health resources. But the problem is that those resources are still inadequate and lacking. It's a systemic issue. The prisons have no interest in reducing recidivism. They get their funding by how many people they have in beds. So there's no interest for them to fund programs that will actually reduce recidivism and empower the person to continue in a way that is conducive with living out in society. So they don't address the root issues at a community level as far as like prevention or education. A lot of these community mental health clinics are going to focus on the individual and individual responsibility, which can work for some people, but doesn't work for a lot of people when they are part of a marginalized community who has had traumatic life experiences. There's no single organization that offers wraparound services for reentry. There's a lot of community mental health clinics that help with the mental health aspect, but if someone can't get housing or employment, it's going to be really hard for them to focus on those internal issues of mental health when they're living on the streets. There are some grassroots organizations that are more focused on addressing those systemic issues, but they're very few and far between. They close down often. They don't have a lot of funding, and they're understaffed. There's like I said, those community mental health agencies take that individual responsibility approach rather than a community resource approach. So you have someone coming out of prison and they are going into a community mental health agency. They don't have housing, they don't have a job, and this community health agency is wanting to focus on their anxiety. Well, their anxiety is not going to go away if they're living on the streets and they don't know where their next meal is going to come from. No amount of CBT is going to help that. And these issues can compound within our clients. So they may have had trauma before going into prison, maybe leading up to going to prison, but then they have a traumatic experience in prison. And this creates a distrust in institutions. Obviously, institutions have failed them. So why would they trust, a program like ours or a community mental health agency once they get out of prison? It's going to be really hard for them to trust that. Jumped ahead again. So this is where we come in. This is that part of their life where they're seeking services, they're out in the community. Maybe it's been a while since they've been in prison. So what are some things that we can focus on and things that we can be mindful of? So I think it's really important to be aware that your clients may have been incarcerated. So not everyone that has a felony on their record has been incarcerated, but some of them have been incarcerated. So being mindful of the fact that they may have had that experience. Also being mindful, a lot of the clients that we work with have mental health issues, and if they have that compounded by being in prison, that trauma could have been exacerbated by that experience. Understand that like clients may have misconceptions of how felonies will affect them. So, kind of making sure that you're informed on what local policies are, what is the true legal issues around housing and employment related to felony records. There's this recent ban the box thing. I don't know if, have people heard about ban the box or know a little bit about that? Yeah. And that's a great, so ban the box is was a policy that was passed where, you know, that box on employment applications where it says, have you ever been convicted of a felony or anything like that? They'll have that box and you have to check it off if you've been convicted of a misdemeanor or felony. So that did get passed. So there's ban the box legislation that is in effect, but it's only for government jobs. And that might be why a lot of us haven't heard of that, because private employers can still put that box there and automatically discriminate against people. And companies will still do background checks. So even if they don't have that checkbox on their application, they'll still do a background check and can easily discriminate based on that. So there's still a lot of issues surrounding how felonies can affect things like housing and employment. As far as I understand, property managers are not allowed to discriminate based on felony records, but it's supposed to be like a case-by-case basis. But a lot of property managers still have a blanket rule that they won't even look at an application if you have a felony record. Other things for us to be aware of is having cultural competency. So being aware of intersecting identities, the client's background, the client's culture, and what support systems they have. And we'll go a little more in depth on that later. And another thing for us to be aware of is resources. So maintaining an up-to-date resource list. Something you can do is reach out to resources to get more information. So maybe you found an organization online that does all these really cool things, but you want to call and make sure, like, if they actually still have those services. What did they actually provide? There have been cases of agencies that act as like a pass-through. So on their website, they say, yeah, we provide GED services and help you get housing. But what really happens is the client goes to that agency and that agency refers out to another agency that actually does the GED and housing services. So this way they can put those numbers on paper and get the funding, but they don't actually provide the service. And this is a huge disservice to our clients, because then they're going to this one agency, but then they don't get what they need there, and that agency refers them to another agency. And it's a huge issue if a client doesn't have transportation or childcare. They're going to all these different places that are not doing what they necessarily say that they can do. And yeah, Christina, absolutely right. It's frustrating. And you can see how this adds to that mistrust of institutions. So another thing we can do as far as resources is kind of opening the door for the client. So something I like to do is, email a referral. Say you give a referral to someone, email that referral, CC the client if they have an email, and introduce them to that agency or to that person, and ask that referral maybe to get in touch with the client, or that'll open the door for the client to respond in an email saying, I'd really like to meet up at this time. So kind of opening the door for the client. Another thing that we want to, especially, and I think with all of our clients, empowerment is a huge skill that we can use. There's a lot of things we can do to help empower clients, like teaching life skills. If a client is just getting out of prison or recently came out, there's a technology moves so fast, being able to help them navigate that new technology or navigate different systems and processes can be super helpful. Be able to identify supports that they have. Maybe they don't realize that a family member could be a support because they haven't talked to them in years. They've been in prison. But they haven't reached out yet to see, hey, wanted to get back in touch, start a dialogue with that. So identifying possible supports and helping them utilize them. Another key thing with empowerment is trusting that the client is an expert on themselves. Trust that they know what they need and that you're not assuming what they need based on your own experiences or based on, you know, previous clients that you worked with. So really keeping that kind of like blank slate, you know, what does this client need? They need to tell me. You can't just kind of put that on them, your own needs. Motivational interviewing is really key to this. Some clients are going to tell you what they need, but not outright. You're not going to say like, this is what I need. And they might allude to it while they're talking to you. So this could mean that they want to talk about it, but they're hesitant. Remember that they might have a lot of mistrust in institutions. So they're not sure if they say like, I need this, are they actually going to get it? Or are they going to be hurt even more by institutions? So just kind of like following their lead on their needs and where they're at. So I want to kind of pause here and ask if anyone has any questions or anything like that. Okay. All right, so we'll move on. Oh, how many mental health providers are assigned to each prison? That's a good question. I don't have that number off the top of my head. I do have a resource list, Keto, and I'll have some resources at the end of this training. And I definitely want to like open that dialogue for everyone. Like maybe we can work together to create a resource list because it's really hard to find those resources. Okay. So I did want to go a little bit more in depth about intersectionality. So I think there is a pretty good mix of understanding of what intersectionality is or knowing what it is. So I think a lot of us understand intersectionality. I've heard of it before. Some of us maybe have heard of it, but don't really know what it is. So I do want to go a little bit more in depth on that. Can anyone provide like a definition of intersectionality? Anybody want to try and broach that? You can definitely type it or you can unmute and talk about it too.
It's kind of like having like several factors that are like making you more vulnerable in society.
Definitely, yes. Thank you, Yuri. Yeah, so, you know, a client may have multiple things that are preventing them from moving forward in certain ways. And Beth says, the way a client's life experiences color their worldview, where they come from, where they've been, how it all affects them now. Yes, so all these different factors in their life create a very unique experience and perspective on the world, and also creates a unique and perspective, unique perspective that the world has of them. So for those who may have never heard of intersectionality, the way I was kind of taught to think of it is, imagine if you're on the intersection of Van Buren and 44th Street. You're like right in the middle of that intersection. Can anyone tell me what street you're on?
No, because you're right in the middle of it.
Yeah, so you're on both streets, right? You can get hit by a car from either street. Hopefully you don't, but and that's what intersectionality is like. So we think about somebody's gender is one street, and their race is another street. They're going to get different things from both of those identities. And if you think about how many different streets people can have, age, gender, sexuality, race, ethnicity, ability, all of these things will have different effects on someone's life. So while some people may have, that really simple intersection with two core identities that they're getting different responses from, some people's intersecting identities looks like this. So they're dealing with so many different aspects of their identity, and so many different issues that come with that. And that's hard to navigate. And it can be traumatizing if depending on what those intersecting identities are. So this is why we want to take a trauma-informed approach. And I think we talk about this a lot here at UMOM, that trauma-informed approach and cultural perspectives. So something to realize when we're working with clients, especially who have been incarcerated and had a lot of interactions with police. A lot of people from marginalized communities experience systemic trauma. They're raised in a community that is very low income, very low resources. They grow up with violence. This violence and police interaction becomes normalized. This can lead to substance abuse, which leads to more police interactions. There's no access to counseling or preventative services. So over time, clients with these, multiple intersecting identities develop a reactive trauma-based response. They're constantly just in survival mode. And this is true of everyone that we work with at UMOM. Homelessness is a traumatic experience. They're constantly in survival mode. Where are they going to live next? Where are they going to get food next? And a lot of people, this is how they've lived their entire lives. They were born into that. And incarceration only adds on to this trauma. And then once they're incarcerated, there's no adequate medical or mental health care to address that trauma. So now we've got just life trauma of being in a marginalized community, and whatever traumas go along with that, and then trauma from being incarcerated, and then trauma from not being treated for all of these other traumas. And this breeds mistrust in systems that adds another layer of trauma. So they're in communities that have no resources. Those systems have already failed them. They're incarcerated. That system is not able to address those mental health issues that may have led to their incarceration. Another system that has failed them. They're coming out into the community again. It's only reasonable that they would expect that any systems that they run into are not going to be able to accommodate them. And then I wanted to talk a little bit more about empowerment as well. So we talked about how the client knows their life better than you do. So we always want to be aware that we never want to make assumptions about the client's life and where they've been and their experiences. Like I mentioned before, motivational interviewing is a foundation for clients to open up to us. So we really want to put that as, we're going into this, these services with clients with that foundation of motivational interviewing. Often clients will allude to their issues and needs, but won't state it outright. So motivational interviewing is designed to bring that out of them and lead them to desire to engage in services. So remember that trauma breeding mistrust in services. We can assist in not only building rapport within our relationship with the client, but building rapport between the client and systems themselves. I'm so sorry. My cats are going crazy. where was I? Okay, so another aspect of motivational interviewing that I don't think we always talk about is our body language, our tone. So people who have been incarcerated or homeless on the streets are hyper vigilant. They're still living in that reactive stage. They're always in survival mode, so they're going to be very hyper vigilant of the people around them. They're going to pick up on whether you're connecting with them or you're not connecting with them. So be really mindful of that. Also being mindful of the power differential. So with them coming in as a client, there's already that power differential between you and them. You're a service provider and they're a client. There's that automatic hierarchy. We really want to work to even that out. So, you know, working as a partner with the client rather than a provider, empowering the client to address their own needs rather than telling them what their needs and their issues are. So kind of evening out that playing field with them. Increasing positive sense of self. All of these things will help to bring that client up to the you know, partner level. Also helping clients develop knowledge and critical understanding of social realities. So we talked about the traumas that come with marginalized communities, helping to realize that the social realities of that and what they can do in their own lives to even out that in their circumstances. Another thing we want to recognize is that systems are not built for clients to be engaged in them forever, especially with rapid rehousing program and homeless programs in general. It's not designed for the client to be in them forever. We don't want them in these services forever. We don't want to be their provider forever. We don't want them as a client forever. We want them to be able to live independently. So being able to disengage from some of the more active parts of doing and having the client do those things and you kind of just like being there as support and as encouragement. We also want to recognize that clients' barriers are not going to go away completely after our program. We might help with getting rid of those huge barriers like homelessness, but there's still going to be stuff that comes up. I mean, we all have those barriers that still come up, but the goal is to help clients get to a point where they're able to acknowledge and address those barriers on their own, or at least know how to reach out to resources that will help them with those barriers. So another thing we want to kind of think about, and this goes back to the mental health clinics being more individualized and talking about individual responsibility. It's going to be really hard for someone to work on their mental health issues and internal trauma and all of that if they have housing issues, if they don't have a job or transportation. So us helping to eliminate those external barriers are going to help them want to address their internal barriers. So this is part of what we can do, is helping address those big external barriers so they can get like into themselves and be like, you know what, I really want to work on this part of myself now that I feel more stable in my life. And this kind of ties into the fact that the reentry system that we have now, where prisons are required to provide mental health resources, but those mental health resources are not adequate and not addressing the root issues, that can work for some people. Like maybe they don't have as many external barriers and they are able to go back into the community and they have a ton of support and they go to those mental health clinics and they're able to do that cognitive behavioral treatment and trauma work, but it doesn't work for everyone. So we want to make sure that we have independent resources and multiple referrals for different needs, for different clients that have different issues and different needs. And the last thing that we can do as as case managers is advocacy. And there's even like the smallest things that you can do to advocate for your clients who have felonies on their record. Just understanding current policy and legislation. There's always things on the ballot for prison reform every year. You can talk with legislators about these issues. There's actually trainings on how to talk with legislators, which is pretty cool because they basically train you how to tell your story in like a 3-minute pitch, because legislators aren't going to want to talk to you for hours. So they train you how to put your story into like a 3-minute spiel that you can give to a legislator that's powerful. Get involved with grassroots and community-led organizations for reentry. Like I said, those community mental health clinics are just not adequate. The grassroots and community-led organizations are going to have more wraparound services. They're going to be more focused on the systemic root issues. They're underfunded, but they make a better attempt at addressing those issues. Talk with people about systemic issues. There's just a lot of widespread misinformation and general belief about how our justice system works. And another thing we can do is question the status quo. Even like in places where you work, or places where you go to get your own services, is that agency truly making efforts to change the system that is harmful and creating harmful norms? How can you, put your own input to the agency to have them be more inclusive and more effective with these issues? And these are some resources that I think is a good starting point, especially if you have a client who is coming out of the prison system and they just need information about like what they can do, how they can pass this huge barrier of just coming out of prison. So Middle Ground Prison Reform just has a ton of information about prisoners' rights and reentry. Khalil Rushton, he's an advocate, a mentor, and an exoneree. So he was exonerated from death row and released from prison for innocence. And he does a lot of advocacy and mentoring of people coming out of the prison system. There's a community-led organization called Arizona Common Ground, and they provide life skills classes, workforce development, a lot of different programs that go beyond that, like counseling and individual responsibility stuff, actual like helping the client build skills, like basic skills. And next slide is stuff that you can do for yourself if you want to learn more about mental health within the prison system. These are really good documentaries and books to read, and can just give you a different perspective and a deeper understanding of what's going on. And then I do have kind of that same poll that I want to share, and so I'm gonna put this test up, and I ask that it's all still anonymous, just answer these questions to the best of your ability. And while we're doing this, if anyone has any questions, please feel free to put them in the chat, or you can unmute and we can talk about it. Yeah, so I'll give you a few minutes to do that test. Christopher asked if I have interviewed any jail, prison, or behavioral health staff directly. I've been part of interviews with inmates who are currently on death row. It's part of my the internship that I'm in right now. So I've been able to observe those. Unfortunately, with the coronavirus happening, I haven't been able to be as involved because the prisons are completely shut down for all visitors. And behavioral health staff, I have talked with a person who works in the prison, and we didn't speak directly about what mental health care is like, but it was very obvious that they were overwhelmed, understaffed, and it was just they were constantly on the go. And I've read a lot of research from people who have been mental health care workers in prisons. Beth has another resource. King Staffing is back up and running. They were shut down temporarily. It's a felon-friendly staffing agency with just felon-friendly positions. That's awesome. There's also next week, there's a roundtable discussion, and Khalil, who was on that resources page, will be part of that with some legislators and former attorneys. And they're going to talk about how COVID has affected inmates and how we can create a more safe environment during this pandemic. So I'll send that link to everyone because it's definitely interesting, and I'm going to attend that. Father Matters also runs a weekly felon-friendly job event. I've heard of Father Matters. Yeah, sounds like they do awesome work. It's been shut down due to COVID, so hopefully they'll reopen. But yeah, I've heard of Father Matters. Sounds like an awesome organization. All right. Any other questions or concerns? If not, you're definitely welcome to go on with your day. I appreciate everyone attending this training, and I hope it was helpful on some level with the work that we're doing here at UMOM. Thank you.